I think there was some humiliation, and that's why if I could go back, I probably would have reached out more to my other Black colleagues. If other kids read this and get something from it, that's like the cherry on the top.
So again, welcome to New Orleans. As you can see, you have a packed room waiting to hear you and your insight and to have what I hope is I'm sure will be a very insightful conversation. I know you wanted to begin with reading a couple of pages of your book.
Yes.
So we'll do that and then we'll get into the conversation.
Okay. I also just like to thank Baldwin Company for hosting this book event. I see a lot of friends in the room and family in the room. I just want to say thank you for coming out to support. I usually start my book events. Can everyone back there hear me? Can you hear me? Okay. By reading just from the first 2.5 pages of the book, just to give you some context for who I am for those who may not know me or be familiar with Legacy. When I was a little girl, my twin sister Oni and I used to visit our mother at work. Her name was Dr. Dale Gloria Blackstock, and in the 1980s and 90s, she was an attending physician at Kings County Hospital Center, one of the public hospitals in Brooklyn, not far from our home in Crown Heights. Our mother worked long hours at her job, and so sometimes we'd head to the hospital after school to see her and do our homework. Walking down the disinfectant-scented hallways, our shoes squeaking on the floors, we'd make our way to the large echoing cafeteria, where we'd pull out our textbooks from our backpacks and settle down to work alongside the physicians, nurses, technicians, and aides taking a break. The staff behind the counter knew us well, especially because we strongly resembled our mother and would smile warmly and ask, "Visiting your mother today?" After homework was done, we sneak into her clinic to ask her for a small change to spend on our favorite red Jell-O. She'd hand it to us, and if we were quiet, let us stay and observe for a minute or two as she examined a patient. Our mother was warm, but serious with those in her care. Occasionally, her face would reveal a smile, but more often than not, she was extremely focused on what they were saying and what was going on in their lives. After all, she'd grown up in the same Brooklyn neighborhood where the hospital was located. The daughter of a single mother from New Jersey, raised on public assistance, she'd become the first person in her family to graduate college. And after graduating from Harvard Medical School in 1976, she'd returned home to her community. At Kings County, SUNY Downstate, she wasn't just taking care of her patients. She was tending to her neighbors. In her interactions with them, she always seemed to know as much about their children and families as she did about their respective medical problems. When you came in for a visit with Dr. Blackstock, you weren't only having your blood pressure or cholesterol checked. You were also meeting with someone who was going to assess how your whole being was faring. I believe our mother practiced what is now known as structurally competent and culturally responsive care, which means that the entire complex nature of the patient's background and the social context in which they live, love, work, and pray is considered during evaluation, and her patients loved her for it. She was always bringing home little gifts from them, a knitted shawl, homemade cookies, cake, tokens of appreciation. My sister and I were only 19 years old in 1997 when we lost our mother to leukemia, and she was just 47. She died too young, but by then her influence had indelibly rubbed off on us. Our mother's passion for learning, her dogged perseverance, and commitment to serving her community heavily influenced our own decisions to become physicians. Oni and I both graduated from Harvard College and then attended Harvard Medical School, the school's first Black mother-daughter legacy graduates. Like her, we both went to work with historically underserved populations after graduating. My sister at Montefiore Hospital in the Bronx, while I went to train at Kings County SUNY Downstate in Brooklyn, following in our mother's footsteps. In the years since then, I had felt her by my side in so many of my own interactions with patients. Her ability to listen to and truly care continues to be a model for me, and it's something that our patients are crying out for now more than ever. Thank you.
Hey, God, I see people though, and the audience. It really is a beautiful book. How many of you have read it already? Okay, so you came with questions tonight. I'm struck by an anecdote near the beginning of your book. It's the height of the COVID epidemic. You're in full PPE gear, mask and mask on top of mask, and a hazard suit and visor, and a Black woman that you're treating asks you, "Are you Black?" Because you can't see any part of your skin or any part of your face. That question had such weight to it. Talk about that particular question and how you received it, what it meant to that woman, and to even formulate that question.
Yeah, so I'll just share the story with those of you who haven't read the book yet. But, so spring 2020, I thought life was good before everything went sideways. I had left my career in academic medicine, which we'll talk about. And I was focusing on building my company, my consulting firm, Advancing Health Equity. I was working part-time in urgent care. And then March hit and even though I was working in urgent care at the time, I was still seeing a lot of patients with COVID. And one thing became clear to me was that my patients were getting browner as the weeks went on. And so I remember walking into what seemed like an endless series of exam rooms to find this young woman. This was probably in April, who was there for shortness of breath after being diagnosed with COVID a few weeks earlier. And as I walked into the room, she was hunched over, her head in her hands, and she got up, looked up at me, and gave me a quick once over. And I said, "Hi, I'm Dr. Blackstock. How can I help you today?" And she said, "Can I ask you something? Are you Black?" And I realized, like you said, like she couldn't see under. I was head to toe PPE at that time because there was so much we didn't know. My blocks were in a bonnet. I had goggles on, double mask. I had shoe coverings, like literally everything. And so I said, "Yes, I am." And she let out a deep breath and said, "Thank you, Doc. At least I know you'll take care of me." And I said, "I promise." And I just realized, obviously, in that moment, I had several feelings. I was so happy to be that doctor that she needed, but I also obviously felt very upset that she seemed to have previous experiences where she felt like she wasn't listened to. And so that's a moment that has stayed in my mind forever, that I will never forget, because also it emphasized to me the importance of our presence as Black professionals.
Today, we're in a new type of era when we're choosing medical care, where we're usually going to some hospital appendix website and you say, if you need this particular person in this field, you drop down maybe it's just me, maybe it's not just me. Probably not just me, but I'm always looking for the Black doctors who drop down in those menus. What do patients come to you specifically expecting? She said that you were going to listen to her. Are there other things that Black patients come to expect from the Black doctors?
So I think to answer that, I want to go into, I talked about my mother in the beginning, of the intro. And, I grew up, we talked about this earlier, with a different reality. I grew up thinking that most physicians were Black, because that was my reality growing up in Brooklyn. I had a Black pediatrician. My mother would take us to meetings of the local Black physician organization. And I'd be in this room, like I was telling you, with these brilliant folks who looked just like me, who were talking about programs and projects specific to our Black Brooklyn community. And so it wasn't until I probably was in college and medical school that I realized that wasn't the case. But for me, what that means is that your physician, or not just physician, your health professional understands you in a way where you don't have to explain everything, and that you feel listened to, you feel valued, and you feel appreciated. I mean, the fact is that even myself as a physician, I look for Black health professionals. All my health professionals are Black.
Yeah.
My OB/GYN is a Black woman NP. actually my primary care provider is actually a Black woman MP too. So I have all of course disciplines too. So I think, that I talk about another story in the book about, an older Black man that I had around that same time who was very, very sick, but said, I don't want to go to the ER because they're not going to treat people like me well. And he ended up going home.